see, last time I discussed the facial nerve. And so today I'm going to discuss the facial nerve injury, what we call facial nerve, palsy or facial nerve lesion. So with regard to the facial nerve, what you know is the seventh cranial nerve. So with regard to this injury to the facial nerve, we have two types of lesion, what we call upper motor neuron lesion, which is this one, upper motor neuron, and then there is also what we call lower motor neuron lesion. That is lesion from the nucleus of the facial nerve or from the facial nerve itself. So all these are lower motor neuron lesion. So when you now take this one and this one too is upper motor neuron lesion. Even though in most of your textbooks, you're not going to see this number 2. You get it because it's a very rare kind of injury that is seen in the daily patients. So what are the causes of facial nerve injury or facial nerve lesion? So we have the first one is idiopathic. That means there is no known cause for the cause of facial nerve palsy or facial nerve lesion. Most of the cases that you're going to see in the teaching hospital, the patient may not likely know the actual cause of the facial nerve paralysis or lesion itself. But then actually there are some predisposing factors that can predispose somebody to the facial nerve injury or lesion. Something like viral infection. So viral infection, any kind, like say all this rubella virus, cytomegalovirus, you get it, all these viruses can predispose somebody to have facial nerve lesion or facial nerve palsy. Similarly, trauma can cause, because when somebody has an accident along the line, somebody may have an injury, along the facial nerve, where it comes out from the stylomastoid foramen. So also other things like tumor, the cancer of intracranial cancer can also cause or predispose somebody to this facial nerve palsy. Similarly, other metabolic diseases like maybe hypertension, so hypertension and diabetic mellitus, DM, all this one can cause or predispose somebody to have this. You get it? So that is why most of the cases that you see in the clinic, they present with this history of hypertension and diabetic mellitus because, if somebody has a blockage of the artery supplying the area where the neurons or the nucleus of the facial nerve is, that can damage the facial nerve nucleus. Are you clear? Good. So these are the predisposing factors or the causes of the facial nerve injury or lesion. So now I talked about the upper motor neuron lesion and lower motor neuron lesion. You know that facial nerve has about 4 nuclei, but we're only dealing with its own motor neuron here. So what it means is that if you now take, the neuron of the nucleus of the facial nerve, if you divide it into 2, upper half and the lower half, where it is located in the pons, the upper portion of the nucleus supplies, the upper part of the face, while the lower half of the nucleus supplies the lower part of the face. That is the easiest way to understand that. So now if you consider these 2 neurons coming from the cerebral cortex, this is the cerebral cortex here. So if you now take this first neuron here, this neuron, as it comes down, it crosses down to the opposite side. If you consider this one to be our left side of the cerebral hemisphere, this is our right side of the cerebral hemisphere. So if you now take this neuron, it crosses to the opposite side. So this crossing takes place at the level of the pons, where the nuclei of the facial nerve are located. You get it? So it crosses to the opposite side. So as soon as it goes to the opposite side, it supplies, it synapses with the neuron in the upper half, and it also synapses with the other neurons in the lower half of the facial nerve nucleus. Are you clear? So that means this neuron, as it comes into the facial nucleus, it synapses with the neurons that supply the upper part of the face, and also synapses with the neurons that supply the lower half of the face. Are you clear? That means neuron from the opposite side supplies motor nucleus of the facial nerve of the opposite side, supplying both the upper and the lower part. So on this side, this right side, neuron from the same neuron now, if you take this neuron, it crosses to the opposite side again, so it supplies the same area as the other one. So, but there is another neuron that supplies the ipsilateral nucleus. So if this is the right side this is the right cerebral hemisphere, this is the right motor neuron of the facial nerve. So this neuron from the ipsilateral side, it goes down to supply only the upper part of its synapses with only the neurons in the upper part of the, facial nerve nucleus. Are you clear? So this ipsilateral neuron only synapses with the neurons that supply the upper part of the face. So it means that it does not synapse with the neurons that supply the lower face. Are you clear? Similarly, the same thing on this side. So it means that the upper part of the face here has dual supply. Lower part has only single supply. Are you clear? So it means lower part of the face, lower two-thirds of the face, only receive innervation from the opposite side, while the upper part of the same side of the face receive, contribution from the opposite side and from the ipsilateral side. Are you clear? Yes. Good. So now, since we understood this concept, let us see if there is a problem with the upper motor neuron. Supposing that somebody has a trauma here, maybe anything like maybe due to accident or viral infection or anything that can cause that. You have a lesion here. That is what we call upper motor neuron paralysis. So it is the left side here. So if you now follow this neuron here, this left side neuron, it goes to the right side. So this neuron supplies the area, it supplies the neuron in the upper part of the face. It also supplies the neuron of the lower part of the face. Are you clear? So ideally, everything here must go, since this neuron is being cut off from here. Are you clear? Okay? So, but you remember, there is also another supply from this side. Are you clear? So since this ipsilateral neuron supplies the upper part of the motor nucleus, the upper part of the motor nucleus, so it's synapses to this neuron that supplies the upper part of the face, so this area is spared. So that means this area of the face is intact, but this lower part is, are you clear? Good. But then here now you are going to see that this ipsilateral neuron is being cut. This ipsilateral that supplies the upper part of the motor nucleus of the facial nerve of that same side is cut. Are you clear? But then, if you look at it, this neuron from the opposite side also synapses with this neuron. So that means this side has no problem. Are you clear? So you are only going to have problem on this right side, on the lower part of the face. Is there any problem? Good. So now we have seen the upper motor neuron lesion. So when you now take another part of the upper motor neuron lesion here, where there is the causation of these neurons coming from either side. So there is the causation here. So if this one is cut, you remember that I said that this neuron, as it comes here, supplies upper part of the motor nucleus and the lower part of the motor nucleus of the opposite side. Similarly, this one also does the same thing. But then remember, this neuron on this side supplies the upper part of the face. This one too on this side supplies this upper part of the face. So at the end of the day, it's only the lower part of the face, the whole two, that are going to be affected. Are you clear? So that means upper 1/3 of the face is going to be spared. Are you clear? So we only have lower part of the face of either side being paralyzed. Okay, good. So we have now seen this. So the other one is when you have complete injury to the motor neuron of the facial nerve of any side. So if we now take the right side, for example, everything here is being distorted. That means the ipsilateral that supplies the upper part, the opposite side that supplies the upper part, also the opposite side that supplies the lower part. So completely everything on this side, right side, Since here now, we're talking about the right side. So here the right side is going to be affected. So completely both the upper and the lower part of the face of the same side is going to be affected. Are you clear? So the same thing with this lower motor, any length of the facial nerve before it divides into that 5 branches that I have discussed before. So before it divides to give those branches, if you also have a cut along it, it's going to give you similar presentation like when you have a cut or when you have a damage of its own nucleus. So the nuclear damage, as well as the facial nerve damage before it gives branches, it is going to have the same presentation or the same problem. So we are going to have the same side going to be affected, both upper and the lower part. I'm sure you people are going to understand it very well, So now what are the features of somebody that has this, facial nerve lesion? So, for example, the lower motor neuron lesion, since everything here is affected on that same side, the major function of this facial nerve from its own 5 divisions is to make the wrinkles of the forehead. You get it? Through its own temporal branch. I'm sure you can remember that supplies the frontalis muscle here. So if this muscle now, if that nerve is damaged, whether at this level or at the nuclear level, the frontalis muscle of that side is going to be paralyzed. So there will be absence of wrinkling. So there is loss of wrinkles on that side. Are you clear? And similarly, if somebody wants to show surprise by raising his eyebrows and what have you, the raising of the eyebrow is also formed by those muscles in the upper part of the face. So there is loss of or inability to raise the eyebrow on that affected side. Similarly, the facial nerve has some sensory supply to the conjunctiva, and the upper eyelid. So there is dryness of the conjunctiva, so because of the dryness of the conjunctiva, there is what we call ulceration of the conjunctiva. That's when the conjunctiva may ulcerate as a result of dryness of it. And also there may be tearing, dropping, the tear may be dropping on the side where the lesion is located. And there's also loss of nasolabial fold, because that we have buccal branch that supplies the maxillary side. So the buccal branch, since it is being, the nerve is being paralyzed, so the buccinator there that forms the nasolabial fold, if you look at your friends, you will see that there is, a fold in between the cheek muscle and the lower part of the face, between the upper lip and the nose, like this. So there is a depression there, what we call nasolabial fold. So that fold is absent in somebody that has, the facial nerve palsy or paralysis. And also there is also sagging of the angle of the mouth. You can remember we said that buccal branch also supplies the muscles around, the oral cavity. So that, orbicularis oculi muscle is also paralyzed. And so at the area where the lesion is, so the mouth is going to be like this. When you ask the person to maybe smile, so the area that is normal, the angle is going to be raised on that side, and the area that's affected is going to sag down. So there is sagging of the angle of the mouth, and also there's what we call drooling of saliva. So the saliva will be dropping from the side where the lesion, because the angle of that mouth is going to be open. So whatever the saliva is going to be produced from the mouth is going to be dropping from that side. So you will see saliva is just coming out from that side where the nerve is damaged. So these are some of the features that one would see, in patient with facial nerve paralysis. And so we have a break.